My name is Quereshy. I am the current residency program director at Case Western Reserve University. I'm a full-time professor and faculty since 2000. I also own a private practice in Medina, Ohio, and I'm the medical director of the Visage Surgical Institute. I did my own research on EXPAREL and Pacira Pharmaceuticals, and I began to use it for basic oral surgical procedures like wisdom teeth extractions. And now we've sort of advanced the use of EXPAREL into larger surgeries, including full mouth reconstruction cases and dental implant surgery, as well as TMJ surgery and orthognathic surgeries. There was a learning curve in the administration and the technique of administering EXPAREL into the soft tissues around the incision sites. And once we became comfortable with our flow in the practice, then in all the post-operative appointments for all our patients, we would then ask them on a pain scale of how they felt after the surgery, 2 days after surgery, etc., and what their narcotic use was and their consumption of narcotics. And by and large, we found that patients, we were already lowering our narcotic use to 15 tablets. We found that they were not even using a third of that, which gave me the sense that EXPAREL was essentially working in the periods of the post-operative phase, in the 2-3 days where the height of pain is essentially increased, and the fact that their opioid reduction was significantly reduced, which made me feel good that I was really helping the public. They all be well studied, well learned on the product. Like anything that we do, everything should be evidence-based, medicine, dentistry. They should talk to clinicians who have experience in using EXPAREL, because I think that without proper instruction, surgeons may not be performing or injecting the medication in the manner that it should be, and therefore not going to see the effects that we all report about. They may get turned off on the product because they're not seeing the effects that we're all seeing in our practices. So I think proper technique and learning from those who have administered EXPAREL for quite some time, experts in the field, before they actually jump on board, and then talking to the Pacira medical liaisons as well, and just trying different methods and techniques. And mostly it's with the gauge of the needle, the infiltration needle that we use for EXPAREL. Initially, we had used a larger needle, and we were finding that there was too much leaking of the medication outside of the soft tissues. We then used a smaller gauge needle, and so by trial and error, we were then able to find a happy medium of using a 25 gauge needle that would allow us, with minimal trauma, that didn't create a larger opening because of the needle size, that the EXPAREL maintained in the soft tissues more predictably. We know that EXPAREL typically will stay in the location where it's injected. It does not tend to diffuse into the surrounding soft tissue, so we want to be very accurate in the placement of that. And then with using a 25 gauge needle and being able to overlap the regions of infiltration, we found that we've had the best effect for full mouth reconstruction and dental implant surgery. It's a larger surface area that we're treating. Is a full upper maxillary reconstruction case with removal of all the remaining maxillary teeth and the placement of 4 dental implants. We are actually going to be using EXPAREL for the entire upper maxillary infiltration. So in this case, we're going to expand our volume of EXPAREL from the 10 cc vial that we have. We're going to expand it to 20 cc's by adding normal saline to that, to give us the 20 cc volume of EXPAREL to distribute in that region. And that will allow us to carefully infiltrate the EXPAREL with overlapping regions of injection sites and cover the surface area that we want the patient to have comfort and relief. So for me, in order to place the EXPAREL, the injection sites are typically about 1 centimeter or less, only because I want to make sure that the overlapping injection regions have been covered. If I create a larger distance, then there may be some region that may not be covered with the use of EXPAREL. So I might be giving more injection sites than the average number of injection locations. You'll see the full thickness skin flap, which has been elevated, and then the EXPAREL is injected using the 25 gauge needle, and in this case we use the 20 cc volume, and injecting 1 centimeter increments or 1 centimeter spacing between each injection site. This is injected in the supraperiosteal areas, that is into the muscle layers. Really, the subperiosteum does not need to be injected. That's not the area that we want to anesthetize and make comfortable for the patient, but it is in the supraperiosteal or submuscular plane. So in the infraorbital areas, and then also around the zygomaticus major and minor muscles, as well as around the perinasal region, giving good local anesthetic administration in all those areas. Finally, I do like to inject a little bit in the posterior maxillary buttress region bilaterally. And you'll see with the 20 cc volume, you have a lot of volume to work with, which you can easily, get a good surface area covered. And there's the completion of the full 20 cc syringe. The opioid problem in our country, and especially in the state of Ohio, is at all-time high. We know that. We're getting lots of pressures by the pharmacy board. Our governor has reached out to all healthcare providers and dentists and physicians to help combat this problem together. And for me, when I explain the use of EXPAREL to my patients, I feel like I'm doing my part. I feel like I am not part of the problem, but part of the solution to help our country and help the citizens of the United States. I would say that we were overprescribing and merely for the fact of our convenience and not looking at the damage that it would tend to cause our patients. So now being very cognizant of that and being cognizant of how we can manage our patients not only with EXPAREL and multimodal therapies of ibuprofen and acetaminophen, but also good counseling with our patients prior to the procedure, helping them to get their expectations to the standpoint of what to expect of swelling and pain and discomfort. I think that's really helped out in the grand scheme of managing our patients' pain. My opioid management has changed with the decrease in total number of prescriptions written. I feel like I'm writing less for opioids. We do, for major surgical procedures, do write a prescription for opioids, but they're not at the quantity levels that you have seen about a year ago. I've minimized that to almost 50% the quantity. My EXPAREL experience has been a positive one, and I'm happy to tell and explain the use of EXPAREL, and it's almost a conversation that I have essentially daily because we're talking about surgical procedures every day. And with that conversation of surgery comes with how do you manage pain. And so EXPAREL really is in the daily conversation of surgical practice, post-operative management, and it's nice to say that we have something that we can offer patients a greater pain control management technique, minimizing narcotic use, and overall just a successful outcome.
Indication: EXPAREL, bupivacaine liposome injectable suspension, is indicated for single-dose infiltration in adults to produce post-surgical local analgesia, and as an interscalene brachial plexus nerve block to produce post-surgical regional analgesia. Safety and efficacy have not been established in other nerve blocks. Important safety information. EXPAREL is contraindicated in obstetrical paracervical block anesthesia. Adverse reactions reported with an incidence greater than or equal to 10% following EXPAREL administration via infiltration were nausea, constipation, and vomiting. Adverse reactions reported with an incidence greater than or equal to 10% following EXPAREL administration via interscalene brachial plexus nerve block were nausea, pyrexia, and constipation. If EXPAREL and other non-bupivacaine local anesthetics, including lidocaine, are administered at the same site, there may be an immediate release of bupivacaine from EXPAREL. Therefore, EXPAREL may be administered to the same site 20 minutes after injecting lidocaine. EXPAREL is not recommended to be used in the following patient population: patients under 18 years old and/or pregnant patients. Because amide-type local anesthetics, such as bupivacaine, are metabolized by the liver, EXPAREL should be used cautiously in patients with hepatic disease. Warnings and precautions specific to EXPAREL. Avoid additional use of local anesthetics within 96 hours following administration of EXPAREL. EXPAREL is not recommended for the following types or routes of administration: epidural, intrathecal, regional nerve blocks other than interscalene brachial plexus nerve block, or intravascular or intra-articular use. The potential sensory and/or motor loss with EXPAREL is temporary and varies in degree and duration depending on the site of injection and dosage administered, and may last for up to 5 days as seen in clinical trials. Warnings and precautions for bupivacaine-containing products. Central nervous system, or CNS, reactions. There have been reports of adverse neurologic reactions with the use of local anesthetics. These include persistent anesthesia and paresthesia. CNS reactions are characterized by excitation and/or depression. Cardiovascular system reactions. Toxic blood concentrations depress cardiac conductivity and excitability, which may lead to dysrhythmias, sometimes leading to death. Allergic reactions. Allergic-type reactions, for example anaphylaxis and angioedema, are rare and may occur as a result of hypersensitivity to the local anesthetic or to other formulation ingredients. Chondrolysis. There have been reports of chondrolysis, mostly on the shoulder joint, following intra-articular infusion of local anesthetics, which is an unapproved use,